Here is your YouTube review for the respiratory system. In this review, I will be going over the first two PowerPoints, the third component on your quiz, the lung capacities. Again, I encourage you to copy the chart on your index card as well as observing the link on Moodle of the professional uh, YouTube post by Dr. Armando that I linked there. The first PowerPoint here deals mainly with the anatomy of the respiratory system. Please recall that the respiratory system has two regions or zones as listed here. The conducting zone, which is most of the respiratory system. You should have an idea of the organs and their order in this zone. And the respiratory zone, which is merely the end where the actual gas exchange occurs in the alveoli. You should recall the three modifications we make to incoming air, and that's to moisten it. We add water vapor, we warm it closer to body temperature, and it's filtered. Debris and potentially infectious agents are trapped and prevented from getting into the lungs. Recall that your throat is your pharynx has three components: the nose throat, the mouth throat, and the throat throat, otherwise known as the naso, oro, and laryngopharynx. Recall that the oropharynx and laryngopharynx, those two regions, that the passageway of the throat here, air shares this passageway along with food. After the pharynx, you get to the larynx and the epiglottis. So on the diagram here, the epiglottis is this flap of tissue. It's made of elastic cartilage. E for epiglottis, E for elastic cartilage. And when you're speaking or breathing, the epiglottis is in this upward position, and air can freely go from the nose down through the larynx into your trachea and into your lungs. When you eat, the food presses against the epiglottis and it folds close over the glottis or opening into the voice box area here, and food is directed down the esophagus posteriorly. The elastic cartilage of the epiglottis is mentioned here. You can see a little tip of it here and side view here. The blue indicates the cartilage present throughout the larynx and the trachea, which keep your airway open. And that is the first PowerPoint. Once we get through the trachea and through the bronchi and then bronchioles, we arrive at the alveoli where gas exchange takes place. The alveoli are very thin, simple squamous epithelial cells. This thinness allows for simple diffusion of oxygen and carbon dioxide across the alveoli into the bloodstream or capillaries, and carbon dioxide moving in the other direction. This diagram, you want to recall that the pleural pressure indicated in the gray space here must always be less than the pulmonary pressure, the pressure in the lungs. And this keeps your lungs stretched and at least partially inflated. It keeps them from collapsing. Pulmonary pressure can go up and down, as we'll learn in the next couple of slides, whether you're breathing in or breathing out. But regardless of the pressure, the pulmonary pressure in the lungs, the pleural pressure is always negative relative to the pulmonary pressure. Breathing in and breathing out, or ventilation, we need to understand minimally Boyle's law of gases as right here. As the volume of a space increases, the pressure of the gas in that space decreases. There's an inverse relationship between pressure and volume of a gas. As one goes up, the other goes down. So we're going to utilize Boyle's law and manipulate it to get air into our lungs. You should know the sequence of events that occurs as you inspire. And that starts with the movement of the diaphragm. The diaphragm in a relaxed position is in an upside down U-shaped, kind of hugging the underside of your rib cage. When you contract that muscle, the diaphragm descends or lowers. As you do that, the volume in the chest or in the lungs increases. Again, according to Boyle's law, as the volume in the space increases, the pressure will decrease. And then this pulls air into your lungs. When you breathe out, we're going to reverse these events. The diaphragm will relax and move back up into its original position. This will decrease the volume in the lung. This decrease will cause the pressure to go up, and then this will allow you to expel air out of your lungs and get rid of that carbon dioxide. And that's it. So I wish you luck.